Hello, everybody. My name is Joe Graw. I'm the Chief Growth Officer at ImageTrend, and we're at the tail end of our Connect conference, and really excited to have a deep conversation here with Matthew Bailey from GMR.
Well, thanks, Joe. Matthew Bailey. I'm the Vice President of Enterprise Applications at Global Medical Response, and looking forward to the conversation.
It's been kind of interesting the last few days, right? So Matthew, from your perspective, as a first-time attendee at Connect and a newcomer at GMR, curious what some of your perspectives are around industry transformation, what GMR is focusing on from a data perspective, let's say.
Data is a big topic and one that's evolving very, very quickly. Looking at data is the new gold. Data is a new gold that we're using for our AI and our automation technologies. So really having the ability to have easy access to our data in a very secure method allows us to have efficient use of our technology to pull critical information, because we're always looking to keep the patient and care at the focus of everything we do at GMR.
We've talked about data constantly this week. We talk about it in the industry often with the lens around, like you said, clinical performance, right? So the emergency medical service data points. Maybe what are some of the other data sources that GMR is looking at connecting to that EMS data to help understand and maybe chart the continuum of care for patients?
Sure. I look at data as, in this context, in two vectors. We've got a first vector, which is patient care, clinical data. How do we have accuracy and excellence in the way we collect data? Obviously, the Elite product gives us access to journal that data and bring it into a very common format using the NEMSIS 3.5 format today, which gives us great flexibility for our downstream processes. That's one piece. Another piece I'm looking at is event ephemeral data. How do we store that? And then we have information such as telemetry from a journey for a truck, a helicopter, a jet. Having the different data sources available to us allows us the opportunity as data scientists to bring this data together and find new outcomes and new opportunities for excellence.
I like the topic of interoperability, integration within the industry and outside of the industry. There are data silos everywhere. I'm sure at GMR those exist as well. What's your take? And I know we talked a little bit about this yesterday.
Yes.
What's your take on interoperability and how that could work and maybe what the benefit of connecting all of these siloed sources might look like?
It's actually an intriguing question, because looking at conversations I've been having with different colleagues within GMR, we're looking at how do we affect our revenue cycle? How do we take these silos of data, bring them together to allow us to have a rich data feed where we can successfully bill on a first attempt? So we can use technologies such as MCP, Model Context Protocol, to bring disparate data sources together, take those silos, make them part of a collective data set. So we're looking at different methods and different approaches to bring those silos back into the fold so we can have better use of them.
Everybody speaks to challenges in the industry around connecting data. We look at it as opportunities, right?
Absolutely.
And from your lens and your perspective, being relatively new to GMR, but not the data industry, what's your take on maybe barriers or opportunities for education around connecting these sources?
Well, partnership. Success I've found in different companies I've been fortunate enough to be a party of is when you can build partnership with the business, so you actually understand the business objective. What is the value we're looking to drive? Once you understand those pieces, you can then look to the reality of the world, which is security. we have to be secure. Governance, we've got to work within the framework to allow us security for our data. Then we can move into automation after we have requirements. And then we can use advanced tools such as AI, ML to get the most from the data. But we've got to start from a position of security and governance, because without that, we're not going to be in a good place. And always looking for positive outcomes and successful outcomes versus random outcomes.
Mm-hmm. Data governance, obviously a hot topic. You've got to get the governance side right before you can focus on the automation and perhaps the AI layer that everyone's talking about at the conference and then also within the industry. I'm curious, once you get that right, let's talk about how AI could be used in the field most effectively.
Really, it's where is our focus? Our focus is care. Our focus is taking people from a bad place to a good place, be that through transport or through our healthcare approaches, having the ability to have the outcome of a successful situation for a person who comes into our care.
Mm-hmm. I'm glad you mentioned care because that is what GMR is all about. And the technology should complement the care.
Exactly.
And if we get that right, make it easy for the providers in the field to get at the data and chart the way that they need to quickly, the end result is longitudinal care and improvements in the patient's experience.
Yeah, exactly, because going back to your previous question, a passion I see of everyone I come across, I work with at GMR, is a passion for keeping care at the center of the conversation, keeping our focus on positive outcomes. And we're using technology always to drive to that goal.
Yeah. And the technology shouldn't be the requirement of that, right? It should be the complement, and it should actually help unlock some of those insights around improving the patient's care.
Exactly.
And also the workforce. I think we talked a little bit about that last night. Curious your perspective on the workforce's take on AI and improvements to charting and the patient's experience.
Yes, a conversation we had in a session this morning with Pat, and it's so important to make the technology a natural piece of the experience for the clinician. If I have to have tools that I have to invest hours and days into training, I don't think we've won as an industry. When we have tools that are intuitive, that allow people to focus on what they are, the passion of care, that's where we win. So looking to get together to, when we bring new technologies in, let's make technology fit the problem, not the problem fit the technology. I think it's a really important focus that I know both GMR and ImageTrend are focused on.
And impact is such a focus, right? Curious in your time and as you kind of immerse in this, what's the impact that you're seeing short term, and what do we aspire, collectively to start to look at achieving more long term?
Sure. Obviously, aspirationally, we've got a goal of perfection. If everything that we do as technologists. Today, we have a great tool set. Our toolbox has never been richer. But again, it comes down to listening, sitting down with our business partners, understanding the need and the drive that they have, taking the approach of 2 ears, 1 mouth. Let's listen, understand, derive strong requirements. When we have the requirements, we can deliver to success. If we just say, oh, I've got a problem, I've got a solution, you start running, you're not going to hit the mark.
When you look ahead, where do you see the industry going? Where do you see first responders, emergency medical service being more connected to healthcare? We again talked about this with the GMR team that's here, and I hear it time and time again is the first responders in the field are really the first mile of healthcare delivery. And how do we continue to enable and empower that to improve patient care and outcomes?
I think once again, it's having eyes open. Let's look at the technology and the tools we have available to us. dealing with what we have today, the tools that we can leverage with an eye to the future. Where are trends going? Where are we going with ambient listening? Where are we going with optics? Where are we going with RFID? So many things that we can incorporate into the vehicle, be that a helicopter, a truck, or an airplane. There's so many things we can do, but again, we've got to find things that fit and go back to the first statement of it's got to be secure, it's got to fit our governance model, and we have to have technology that's going to be effective for our end goal of patient care.
Yeah. And I like that approach as well. Security, governance, and then focusing on the tech side, AI primarily. And I like what we talked about on the ambient listening side as well. One of the goals that we mutually share is less time on the keyboard and the tablet and more time with the patient.
Absolutely.
And I believe that we're moving in that direction. From your perspective, outside of security, outside of governance, let's say that we've got those taken care of and in a really good spot to where we can start advancing the AI initiative. Where do you see challenges there from a GMR perspective? And then again, we talked about the opportunities, but maybe speak a little bit more to the crew's perspective.
And we use technology and we're using ambient audio. We've got a signal to noise ratio we have to deal with. We can't defeat physics. We've got to look to see how do we use the technology to its best and get the most out of it. Again, these vehicles are loud. They've got sirens. They're moving at high speed. People are getting jostled around. If you're not strapped in, it's the environment we've got to be very careful of. And again, we've got to use the right technology at the right time.
Right. Yeah. And as we continue to advance AI with security and governance in place, what we often have to remind ourselves of is today is the worst you'll see it. The models are growing and learning so quickly that advancements 3, 6, 9, 12 months from now are really going to enable opportunities for clinicians to free up the majority of their time to focus again on the patient. The data should complement that, and I think that's the exciting opportunity for us in the near term. What advice would you give to other agencies, other systems, that are thinking about the things that we just discussed today? Connection, collaboration, healthcare focused, patient-centric, workforce. There's so many different priorities. Where would you start if you were to give somebody advice here at the conference?
Well, I'm going to sound like a bit of a broken record here. We've got to start with security. Everything we do has to be secure. We have to have strong governance, and we've got to look at the end situation, the care. Everybody I've spoken to at conference, everyone's got the same passion, which is care. As long as we can make sure we do that in a method that allows for success for the individual in question, that's the strong goal. So again, everyone in this conference has got the same passion. Yeah. Let's just make sure we do it in a very strong, positive step forward. So we're doing things that we can actually make sure we are delivering the utmost best solution we can. And again, in a very secure method, because there's a lot of bad actors out there who really want our data. And we've got to basically make sure that we make it as hard as possible for the bad actors not to get to our data, but at the same time have great interoperability and connectivity amongst the partners we have those trust relationships with.
I'm glad that you said security several times today.
It's a passion.
Yes, I think it is. It is something that we talk about quite a bit. I think that should not be overlooked as well. And just like platform development, security development needs to adapt and iterate at the speed of those types of changes. And I think if you can't keep up with that, you're right, you can't have the AI and all of this additional technology in place. So I really appreciate that. And I think that's a message too that we want to continue to communicate to the people in the industry, the folks at the conference here as well when they start to ask questions about how do we do this? How do we implement some of this stuff? So
that's it. You got to look at the cases of the folks who are trying to do things nefariously, and make sure we stay very focused on our mission and forge ahead.
Yeah. Matthew, I appreciate the time. Always great to catch up with you.
You too, Joe.
Yeah, it's been a pleasure.
Thank you so much.
Thank you.